South Africa has recorded over 4,000 cases of COVID-19 for a second successive day. 4,631 new infections were reported in the last 24-hour cycle. The positivity rate was 17.7%, up from 15.8% in the previous reporting period. Active cases have increased to over 22,000. 10 new COVID-19 related deaths have been reported, taking the death toll to 100,286. Well, the Health Department says that while the increase in COVID-19 cases is not a cause for alarm at this stage, it's monitoring the situation closely.
This may be a minor flare-up and that the fifth wave will come from a different variant and will come later. But it may be that there's sufficient virulence or aggressiveness within this variant and enough transmissibility, that's passing it on from one of us to the other, for it to cause more infections. We are seeing hospitalizations. We are seeing children being hospitalized. We're seeing a lot of young people, and of those that, look, the numbers are still small, but of the people who are being admitted, it's unvaccinated people, and we've warned repeatedly that just thinking that you may have wild virus immunity because there's wild virus immunity in the community is insufficient. We don't know how long those antibodies last for, and we don't know how protective they are. What we do know is repeated exposure to the vaccines through vaccination programs does help to get better remembered immunity. And what we talk about is cellular immunity, not just antibodies. So we have complex immune responses, and we don't get enough immunity from being exposed just once. We need to be repeatedly exposed, and preferably by a safe protein that is similar to the virus and not the virus itself. So we really want to encourage people, don't wait until this does or doesn't become a wave. If you have not been vaccinated, get vaccinated. And if you have been vaccinated, make sure you have all your doses, including a booster.